Welcome to Akademixx Global, your destination for medical learning and digital healthcare tools. Today we will explore BMJ Best Practice, one of the most trusted clinical decision support tools used by healthcare professionals worldwide. BMJ Best Practice provides evidence-based information to support diagnosis, treatment, and management decisions in real time. It is widely used by clinicians, residents, and medical students for quick and reliable updates. Let's explore BMJ Best Practice. Now I am logging to my BMJ Best Practice account. Once you log in to BMJ Best Practice, you will arrive at the homepage dashboard. Here you will find a clean and simple interface with a search bar and your recently viewed topics. Hover over or click inside the search bar and type any clinical condition. Let's search asthma. After typing asthma, now auto suggestions appear. Now I am selecting the asthma in adults. Each topic in BMJ Best Practice is divided into clear, evidence-based sections, making it easy to navigate through diagnosis, management, and follow-up guidelines. It includes overview, theory, diagnosis, management, follow-up, and resources. Now let's start from overview. Overview includes summary, which is the summary of this topic, asthma in adults. It includes definition, history and exam, diagnostic investigation, algorithms, and the authors' contribution and peer reviewers and the references. The next is theory. Theory includes epidemiology, its prevalence, and then etiology, pathophysiology, and the case history. Its presentations. In the diagnostic section, the first one is approach. It includes the flowcharts, objective test, structured clinical assessments, history and physical examinations, and videos for explanation, investigations, the next is history and exam. It includes key diagnostic factors like presence of risk factors, expiry diseases, dyspnea, cough, chest tightness, and others. And it is also segmented in common, strong, and weak diagnostic factors. Then the next is investigations. Investigations include the like in asthma, first investigation to order is spirometry, peak expiratory flow, and other investigations to consider is CXR, FBC with differentials and others. And emerging tests are sputum eosinophilia. And the next part is differentials. Yes, now you can see it's differential with COPD, chronic rhinosinusitis. It includes the signs, symptoms, investigations, and many other conditions. And finally in this section is criteria. And the next section is management. And the first part is approach. It includes all the details like education and environmental control, exercise-induced bronchoconstriction, stepwise therapy for long-term management, and the flowcharts, summary of management in adults, and many others. The second part is the treatment algorithm, which includes the interactive flowcharts, displays steps for mild, moderate, and severe cases. And like you can see, the treatment algorithm shows the infrequent symptoms and what are the first line, like SABA is needed, plus education, environmental control, consider exercise-induced, management of exercise-induced bronchoconstrictions. Like you can see, first line SABA is needed and all the details present, plus education, environmental control, and other management of exercise-induced. Step 1, initial therapy, not SABA is needed. Low dose ICS, then SABA plus SABA is needed, and education. So it goes on to other steps like fixed dose LABA plus dose ICS. The next part is emerging treatments. Like it includes all the latest available studies on the latest drugs for treatment and treatments for the diseases. And the next part is prevention. So it includes the details on secondary preventions. And the next very important part is patient discussions. It is good. It includes all the details which can be helpful for you for patient counseling. These can also be used for patient education sessions or telemedicine consultations. And the next part is follow-up. Next section is follow-up, and the first part is monitoring. Now you can see the monitoring part. It includes after the treatment what steps you want. Yes. Then the next part is complications. Now Now you can see the complications: severe exacerbation, moderate, airway remodeling, and others. And the final part in the follow-up section is prognosis. Prognosis, long-term effects, life expectancy, remission. And the final section is resources, which includes the guidelines, international guidelines, and you can see all the details. The guideline is published by, and its time when it is published. You can see the UK guidelines, European guidelines, North American guidelines, and other Asian and rest of the world. Now I'm opening guidelines. Okay, now you can see the prescribing guidelines details. Now I am moving back. Okay. Now the next part in the resources is images and videos. That's very important. You can see images and videos for any disease, any condition. Like you can see on this topic, it is videos, polyphonic V's, expiratory V's, peak flow measurement animated demonstrations, and images like asthma in adults. Beautiful illustrations present in this. And the next part is references. Every recommendation in BMJ Best Practice is supported by high quality references. You can verify the evidence directly through the links to trusted guidelines sources like NICE, WHO, and Cochrane. Now you can see it is redirected to the Journal of Allergy and Clinical Immunology. Now I am moving back. Okay. And the next part is patient information. Now you can see the patient information in English and other language as well, like Portuguese and Espanol. Now I'm clicking on a patient information. How I can tell when my asthma is getting out of control. So it is good for saving time for the clinicians. You can download its PDF as well for the patients. You can provide the printouts to the patients as well. And the last one is the evidence. Here you can see all the evidences. Now it is redirected to the Cochrane library. You can see it is redirected to the Cochrane library, the question and its clinical answer. Now I'm moving back. One important feature in the BMJ Best Practice is you can view PDF for all the details on any topic. Like I'm clicking on this view PDF for the asthma in adults. Now here you can see this 102 pages on the asthma in adults. All the details are present in this PDF, which we have already seen in different sections and their parts. Now I'm moving to home page. Other important key features are what's new, which includes the clinical updates with the dates. Like you can see this on 12th November, the important update is assessment of abdominal pain in pregnancy and opioid use disorders, shock, Alzheimer's disease. And the next is news by BMJ Best Practice, and third is podcast. BMJ Best Practice keep us up to date with the latest scientific developments, evidence-based medicine, and guidelines. And the next important feature is specialties. You can find all the medical information by specialty wise as well. Like if you want to only need information for the hematology specialty, you can click on this hematology, and then you can find by alphabetically as well, or emergency. And then the next important feature is calculator. Like you can search the calculator by via alphabetically, or you can find in the search bar, or you can also find your calculator by selecting any specialty. Now I am finding the BMI. Yes, now you can see it shows the BMI calculator. Now I want to check the APGAR score, which assesses neonates 1 in 5 minutes after birth. Okay, now I will find a calculator by specialty. Like I want to find some calculators for dermatology. You can select find for Kawasaki disease diagnostic criteria, the passive psoriasis area and severity index. Now I'm clicking on this. You can put all the details for the next important feature, which we have already discussed, is patient information. You can find patient information on the different disease topics and conditions. Next is videos, multimedia, and it includes the videos and podcasts. Here you can find the videos for the different topics. And I think the remaining one is the your extra feature is case reports. Here you can see the cases on different conditions, diseases, and via different specialties you can find out. And the last one is evidence resources, which we have already discussed earlier. Another advantage of BMJ Best Practice is that it automatically records your CME or CPD credits as you learn. These features helps medical professionals maintain professional development records effortlessly. BMJ Best Practice provides reliable evidence-based content. It is regularly updated by clinical experts. It is useful for exams and patient care. That's all for today's tutorial on BMJ Best Practice. If you find this helpful, don't forget to like, share, and subscribe to Akademixx Global for more medical learning content.